So I'm in a video doing some mobilizations and a little bit of traction for her. I did a spinal mobilization course. Come on, friend. Come on. Come on, my sweet friend. And where it's not manipulation. I'm not a chiropractor. The idea is we're creating a pathophysiologic effect by bringing blood flow into the area. And it's just based on Matlin's grades of mobilization. And so all I'm doing is just a slight little movement going down each cervical vertebrae. And again, trying to bring blood flow in the area, get inflammation out, stretch a little bit of the nerve endings to decrease pain, and then ultimately, hopefully, get to where she's a bit more comfortable and then can move her neck a little bit more. She's a good girl. You're a good girl. Yep, just gonna go the other way now. Ready? Your neck is so little. And this is nothing you all would be doing. I do like to try traction, and head or cervical traction is the hardest thing to kind of get a dog convinced to do. It's this subtle movement. That's what they end up doing, is moving the head. But what I do like, especially for her conditions and her lumbar spine, is tail traction. And I'll send a pre-made video for this, but since she's right here, again, the idea behind traction is you are creating more of a pathophysiologic effect at this level. We can't, move the vertebrae at all, but all I'm doing is stabilizing right over her sacrum, and then I'm going to follow the normal angle of the tail and give a gentle continued pull and traction. And they usually don't mind it once they get used to me kind of holding onto the tail. So good girl. You can do it standing. You can do it when they're laying on their side. And then the idea is once you're done, is you let it recoil kind of back on its own. I try to visualize it as I'm stretching a rubber band a little bit. So, but that's tail traction. I really like it for lumbosacral dogs. I've used it a lot on German Shepherds that have a neuritis or radiculopathy similar to what is suspected with Scout here, and I've seen it improve the discomfort going down the leg. And so the other option, or not an option, but the other thing you can do, can I get you this way? We'll face the camera, sweet pea, is, hi, there you go, hi friend, is, hold on friend, and you can do it when they're standing too. You're fine, just hold still. The way I do it then is I just stabilize against their rump or their ischiums, and then do the traction. And hey friend, so I'm just giving a gentle tug, and then you can aim it in either direction. I lost my grip on her tail that time, so starting over. So I'm just going to hold it. And the idea of traction is ideally if you can hold it for a minute or more. A lot of times they won't let you. Seems to be a better positioning for her though. So I usually recommend, like, watching TV or just relaxing. That's a good time to do it. And I do suggest a couple times a day. And then again, I'm just going to kind of let go. That's tail traction. There's a few other ones we'll get into too. I'll video for those at a later time. You're being a good girl.